Dr. Chris, orthopedic surgeon and sports medicine physician, and today we're going in depth on Earl Thomas's injury, or what happens when you screw up on YouTube. So a few months ago I did this video on NFL injuries called Doctor Reacts to NFL Football Injuries. On the first clip of the video, I screwed up on that one. I was actually talking about the wrong player. I wasn't really paying attention because Earl Thomas is number 29, and instead I was talking about number 30. Yeah, that's a problem. So I gotta take an L on that. And I have to say, you people really are passionate about the game of football, because there were some people who were really upset, really freaking triggered. Nathan says, this dumbass doctor looked at the wrong player in the first effing clip. It was the guy trailing the receiver that got hurt.
Jesus Christ.
They let you practice medicine?
I'm not sure which one to cut here.
Clearly that was wrong. So today, we're gonna fix that, and I'm gonna give you the down and dirty, in-depth review of Earl Thomas's injury. We gotta first watch the video, and this time, I'm gonna watch the video from several angles to make sure that I do not miss what happened to Earl Thomas. So this injury occurred on September 30th, 2018. It's in the fourth quarter of the game. Seahawks are on defense. So on this play, the Cardinals who are on offense, the Cardinals QB drops back on a passing play. Earl Thomas, who's the safety for the Seahawks, is covering a receiver downfield. The quarterback passes the ball towards the near side of the end zone to a receiver who's cutting back. Earl Thomas, who is the defender that is trailing that receiver, is following the receiver by about 1 or 2 steps, while another defensive back, number 30, is running downfield to try to break up that pass. As the receiver goes to the ground to make the catch, Earl Thomas, which is in the trailing position, comes behind this receiver and kind of has to hop over him as the receiver goes to the ground so that he doesn't get tripped up by this player. And as he does so, it seems that he bangs his leg. And to be 100% honest, when I first reviewed this injury for my other video, I wasn't really sure how he got injured. And that's why I didn't think it was this guy, because it really looked pretty innocuous. And to me, it looked like the other player, number 30, had suffered a hyperextension injury of his knee. However, that proved not to be the case. You can see that Earl Thomas is on the ground, and he's definitely grabbing his left leg. He's kind of, checking his ankle to make sure that that works. But you can see that he's grabbing his left shin, and he's having real trouble. And if you look here on the slow-mo, you can see that as he checks up to avoid smashing into the other player, he almost kicks the other player. He kind of kicks him in the side with his shin. There's a little bit of history behind this, which I'll talk to a little bit later in the video. So we see here in the following clip that they're helping Earl Thomas up onto the golf cart because he's having a whole heap of trouble weight bearing on that leg. He's unable to stand up. As I'm sure most of you know, Earl Thomas was in the middle of a contract dispute at this time, and he was kind of holding out to get his contract renewed. The team had not yet done so. He had been really concerned about injury because he had injury to that leg previously. As he's being wheeled off the field, he kind of did a little one-finger salute to the team because he was a little bit frustrated, understandably so. Here we have another view which is from a better angle, and this is kind of from the other side of the field, and this angle really allows you to see what happened. As he's slowing down, he comes across and basically plants his leg just by the side of the down player. So basically he has a blunt force trauma to his shin on the pelvis of the downed receiver. Although this is a different bone than which this fracture typically occurs, it's the same type of mechanism that occurs with what's called a nightstick fracture, which typically occurs in the forearm, where somebody puts up their arm to avoid getting struck with a billy club or a bat, and they suffer a transverse fracture to the bone. And this is kind of the same thing. If you're familiar with Earl Thomas, you'll know that either 2015 or 2016, he suffered a similar injury in much the same area where he injured himself in September of this year. If any of you watch UFC or are familiar with MMA, then you'll know that this mechanism of injury is similar to that suffered by Anderson Silva in his fight versus Chris Weidman several years ago. And if you're a fan of UFC, be sure to have your post notifications on, because I'm going to be doing an in-depth review of that injury in an upcoming video. But at any rate, if we can take one lesson from the Anderson Silva-Chris Weidman fight, it's this. A knee to the front of your shin or the tibia is probably not gonna end well for the tibia.
What?
A knee to the front of your shin or the tibia is probably not gonna end well for the tibia.
Okay.
So when Earl Thomas injured himself in 2016, he apparently suffered a tibia fracture. I tried to get some more information about exactly what type of tibia fracture he suffered, but I couldn't really get any, and there weren't really any pictures of the x-rays or anything like that, so I just had to guess based on what information that I could glean from the articles. And basically it said that he had suffered an injury of his tibia, but that the doctors had determined that he did not need to have surgery at that time to repair or to heal that injury. And so he was treated non-operatively. The only fractures that we treat non-operatively in an adult population are typically those that are non-displaced. My assumption, because he had this treated non-operatively, is that the fracture was a non-displaced transverse fracture of the tibia. Afterwards, the patient, or in this case Earl Thomas, could go on to return to play at a high level once the fracture had healed. But this time, however, the doctors elected to treat Earl Thomas operatively for this fracture. Now that could be because of one of several reasons. I could assume that in this case it was displaced. It may also have been that the fracture was undisplaced, but because he had refractured at the same site, the doctors then elected to treat this operatively so he could, number one, minimize his post-operative recovery, number two, and decrease his chance of further refracture at the same site again in the future. Or three, that this fracture was significantly comminuted, or there were several pieces, and it required more sturdy or more rigid fixation than could be obtained with simple cast immobilization. It was likely one of those reasons, or a combination of one or more of those reasons, why they elected to treat it operatively this time. At any rate, you know, Earl Thomas is a young, healthy athlete, and this is something that should be able to be fixed adequately. He should recover well from this, and has been said by some of the color commentators on several of the sports channels, he'll go on to play football after this. He may not play for the Seahawks after giving them the single finger salute, but he'll go on to play for another team, and he'll go on to do well.
What?
And just in case you didn't understand, let me break it down, Cole's Notes version in English. In this case, if the bones were moved and they were not aligned one on top of the other, something like this, something like that, or if there were lots of pieces of bones, then it would make more sense to treat this with an operation and put a rod down the middle of the bone to stabilize the fracture. Or if the doctors were afraid that they just might end up seeing Earl Thomas again because he might refracture at the same site, they may have decided, you know, we're gonna bite the bullet this time and we're gonna put a rod down that leg. Either way, a titanium intramedullary rod is what Earl Thomas bought when he went to the fracture store. After an injury like this, and you've been fixed with intramedullary nail fixation or a titanium rod down the middle of your leg, generally we have to wait for the bone to heal. In ideal circumstances, this can take anywhere from 6 to 8 weeks. And during that time, you'll generally progress from non-weight bearing through partial weight bearing to full weight bearing at the end once the bone has healed. Once that has occurred, you'll be able to fully engage in physiotherapy. Because this nail is typically inserted through the knee, you'll have to get some physiotherapy for the knee itself to restore your knee range of motion and the strength of your leg muscles, such as your quadricep, hamstrings, and the muscles of the lower leg. You'll also need to work on your ankle range of motion because that's probably going to be reduced due to the immobilization or the lack of activity during the time of healing. With 6 to 8 weeks for the fracture to heal, and then again another 6 to 8 weeks at least for physical therapy, you're kind of looking at a rehabilitation period that will extend anywhere from 12 to 16 weeks, so 3 to 4 months. And after that time, he'll be able to begin training and getting back to his regular activities. So there you have it. I'm Dr. Chris, and today we've gone in depth on Earl Thomas's injury, or what happens when you screw up on YouTube. If you like the video, be sure to give it a big thumbs up and share it with a friend. And if you're new to the channel, be sure to subscribe so you can join the intern army. Hit your post notifications so that you can be notified when we post new content. And as always, that's been a word from Dr. Chris, not your everyday ortho.